Welcome back. Time for the this very important interview. Now, just think about this. We go to the hospital for a quick checkup, and the doctor says you have a lump and that he needs to do some further tests. What comes into your mind? The C word? Cancer? You know, cancer is here with us to stay, and we have no choice but to find a way out of it. Now, promoting public awareness and action on risk factors, early detection and diagnosis are some of the vital things that must be done. Now, the Ministry of Health, together with stakeholders, intends to commemorate World Cancer Day on February to push this agenda. Just to tell us what is about to happen, and of course how we can really deal with cancer, is of course our very precious guests here. We have close to Mr. Mutegi, Dr. Fredrick Chite, who is a medical oncologist. Welcome to the Power Breakfast Show. And of course Dan Obura, who is a social media volunteer and also a cancer survivor. Thank you so much indeed for coming. Right, perhaps we could start with you, Dr. In terms of the fight against cancer, how far are we as a country?
So I would say currently where Kenya is at the moment, we are really, really far. And I can say that because I have the wonderful opportunity of having not only trained but also practiced in the United States, and also been here running several programs in oncology at Moi Teaching and Referral Hospital and Moi University. And where we are, I think we are at a starting point, but I think there are so many things that need to be done to actually bring the care that we always look forward to, the personal care for cancer patients. And we have so many things that we need to do, from the screening to early detection to very good treatment modalities for these patients, as well as the multidisciplinary approach to care and even follow-up of our cancer survivors. And there are so many links that are missing in between. So I think that there's a very, very long way to go.
Yeah, because we still have huge numbers of people still going to places like India to get medical treatment.
Very true. And part of that, it's actually multifactorial. Part of it is, if you look at training and education, for instance, in cancer care in Kenya, so we do not have any school in the country that trains oncologists in this country. So if you want to be trained as an oncologist, like myself, I had to train in the US.
What is oncology? First of all, tell one.
So oncology is the study of cancer.
Yes.
So an oncologist is a subspecialist whose main work is actually to treat patients with malignancies, and malignancies are tumors that are actually cancerous. So with that kind of training, what you do first, you'll first of all finish your MBCHB, which is Bachelor's of Medicine and Surgery, which is your undergraduate program, and then you'll do a master's. You can either choose a master's in surgery or a master's in internal medicine or pediatrics. After the 3 or 4 years of master's, then you go and subspecialize. And in subspecialization, if you're an internist like myself, you subspecialize in medical oncology. And during my training, I actually did both medical oncology, hematology, and bone marrow transplant. So that is at a subspecialty level. And if you are a pediatrician, then you become a pediatric oncologist. So you are an oncologist for pediatric population. If you are a surgeon, you become a surgical oncologist. So we have all these cadres, and if you did radiation, then you are a radiation oncologist. There are all these cadres of staff in a complete multidisciplinary care that actually gives proper care to these cancer patients that we really love.
Are you saying, as a matter of fact, there is no school in this country which trains?
No.
Why?
No. So actually,
why is that so?
What I can say is that it's really unfortunate. I think
the medical school in Nairobi has been there for years,
exactly,
as far as I know.
Exactly.
So why are they not having that?
So one of the things I would say is that it's only recently that I've seen there has been quite a lot of attention geared towards cancer. One of the problem has been, you know, as a third world country, we have really been fighting a lot of other diseases. So infectious disease has always been on the forefront. So with people concentrating so much on HIV, a lot of these other chronic diseases were really forgotten. And I've seen that within the ministry, and this I can say for sure because the Ministry of Health arranged a meeting in Naivasha last year where we actually came up with the Kenya Cancer Management Guidelines, and they brought together everybody in this country that deals with cancer care. And so I think there is a step towards that end, but there has been an overwhelming support for HIV and TB and malaria at the expense of cancer. What I can tell you, which will surprise you, is the fact that globally around the world, cancer kills more patients than HIV, TB, and malaria combined, globally. And the focus, for most of the time, when we focus on infectious diseases, we tend to forget about all these people who have non-infectious conditions and malignancies and all. Also, our communities, people have had a lot of myths about cancer. How many people have you had in various families where they say that that person was bewitched or something like that, when we know for sure if you had good diagnostics and you had good doctors that can be able to actually diagnose the condition, it could be cancer and it could be treatable. So part of it is we really need a lot of sensitization, but also a lot of training.
But people believe that cancer is not treatable.
That is also a myth. And thank God for this kind of the World Cancer Day this year, because our the theme is actually...
If you have got cancer, it's a sentence to death.
It's true.
That's how the people believe.
The theme this year is debunking the myths. That's one of the myths.
And of course, it's a great honor to have you, Mr. Dam, here, because when you talk about a cancer survivor, that's indeed a very positive light.
True.
Yeah, tell us your story.
Well, my story dates back to '99. That was when I was actually diagnosed with Hodgkin's lymphoma.
What is that?
Hodgkin's lymphoma is a tumor. It developed as a growth on the left side of my neck. And when I went for my first examination, the doctor concluded that it was accumulation of fat. So I was put on no-fat diet, so I was having fiber and I was off fats. But 2 weeks later, the growth actually became bigger. And that's now when I went to now a more professional doctor. This was now my uncle, who's an ENT, an ear, nose, and throat specialist. And immediately he diagnosed me with the disease. So I went into surgery. This is now the following day, which was basically a biopsy where it took a piece of the tumor. Then it was taken to Italy for examination. Then my results came back. Then immediately I was put on radiotherapy. Basically, this was in Nairobi Hospital. And radiotherapy was to just shrink the cells accumulated. This is now on my neck to my lower abdomen. And it was, there were side effects to it. But after I finished my radiotherapy, I thought it was over until they had to introduce now chemotherapy, which was one of, like, I can say it was an experience that I wouldn't want anyone to go through. Yeah. So yes, I lost hair, I lost weight, I lost my appetite, and all that. I had very few friends because not so many people knew what I was going through because I was very secretive towards it. But when I was declared cancer-free, this was now 2003, I got to meet so many people, interact with so many people in the hospital. And for me, I thought I was the only one until now I met people like Dr. Chite. And yeah, I just came out and started talking about it because I know people need the inspiration.
So how did they remove it? Why were you declared cancer-free?
After my
because you know cancer is not, cancer cannot be free. Once cancer is cancer. How was it sorted out?
Which is not true.
Basically, there are tests towards it. So after I did my chemotherapy, I went for a procedure which they took some fluid out of my mallow, and they couldn't detect the cancer cells anymore. This is now after my full treatment and all. So I was told, you're good to go. And yeah, after that, I keep on going for my annual checkups. But since then, I've been good, I've been healthy. And yeah, thank God for it.
Yeah, perhaps you could tell us, Dr. The issue of the meats, because one that Wamtega said, I mean, once you have it, that's
I don't agree with completely.
The common beliefs.
This myth, I actually can say quite a lot about it. And one of the things that goes on to fuel the myth is because people are not seeing survivors like Dan here. Like, the more you see people who've actually gone through cancer with proper treatment, and you see them living long lives. I have patients with breast cancer that we've been seeing for 8, 9, 10 years that we continue following without any signs of the disease back. One of the things I have to explain first is that cancer is not one disease. So cancer is a group of diseases. There are more than 120 types. And each of these diseases is managed separately and independently. And that's why you actually really need specialists to really manage your care. Because the way I manage breast cancer is totally different from the way I'll manage Hodgkin's disease or Hodgkin's lymphoma, for instance. And then also cancer, it depends on why we say early detection is important, is because the prognosis or the length of time or the survival somebody has or the potential of curability is actually dependent on the stage. If somebody is stage 1 breast cancer, these are patients whom you know for sure, almost 99% of these patients will be alive at 5 years. We usually look at 5 years as a mark in which to gauge various cancers. And most importantly is that why we tell people come early when you see a small lump or anything like that, we want to get you when you're still in a very early stage so that we can actually treat it with a potential for cure. But when you get to stage 4, then stage 4 cancers, by and large, are not curable. We can actually do very good palliative care. Palliative care is whereby we'll give you care that will prolong your life, will actually improve the symptomatology or the symptoms that you are having, but we cannot really for sure tell you that we'll cure you. So it's important for us to eliminate that. Saying that cancer is more than 120 types of diseases, it's important. The only important characteristic the cancer shares is that it's abnormal growth. So these cells grow abnormally, unlike your other cellular growth that should grow normally and get restricted. And then these cells can invade. So cancer cells, unlike your normal cells, they end up invading into the basement membrane and actually can also what we call metastasize. You've heard this word so many times when they say, somebody says, I have metastases. Metastasis simply means that the cells, or the cancer cells that were in a certain part of the body have actually moved to another part of the body. So usually that shows that you're actually at stage 4, that the stage has actually increased. So it's important for us. One of the myths of not curability, it's not true. A third of the cancers can actually be cured very well. A third of the adult cancers can also be very well managed, that somebody can live almost normal lives. And a third of the patients who present very late, of course, their cancers, we may not really be able to support them very much unless we send them to hospice. In pediatrics, we have a different story. Almost 90% of pediatric cancers can be cured. So the most important message to tell people is, if you have any abnormality that you notice, please seek proper attention. Because I've seen quite a number of patients I meet. A lot of them tell me, I've already seen 8 or 9 or 10 different doctors or different health professionals. But you know, most of those people probably do not have a lot of information about cancer care, and they keep treating either TB or whatever it is they treat. I'm not so sure how many professionals you saw before the actual diagnosis was made, because on average it's between 6 to 8 professionals that have been seen. So these are, it may be a nurse, it may be a CO, it may be an MO, it may be a physician. So the most important thing is that as we educate the masses about cancer care, we also need to educate the healthcare professionals.
How is it that in Kenya today, a lot of men are dying of prostate cancer? One of them in the newspaper today.
Yeah, actually, so
why is that prostate cancer killing people?
Very interesting that, and I can actually tell you for a fact that there is a high incidence of prostate cancer by just being black. So yes, it's higher incidence in blacks than Caucasians. So even in the US, we see a lot of prostate cancer. The risk. When I talk about